Dr. Paul here. For some reason, some of you love looking at belly buttons. So this is our compilation of umbilical granulomas. That's where you've got this weird white tissue that sometimes is oozy, goopy, and we're gonna cauterize it at times with silver nitrate, clean it up. If you have a wish to look at more belly buttons, we're talking newborn belly buttons, take a look.
And it was bleeding a little bit after it,
So that's just dried blood.
Okay.
And that's just an old scab. See that?
Oh.
So that stuff can come off. And the blood is sort of irritating to the tissue.
Yeah.
So you want to go ahead and do baths and clean this up. Soap and water works fine. I'm just using a sterile Q-tip and some water at this point.
So like a washcloth, or should we use a Q-tip to clean that? Or
Yeah,
do we
I'd
need
say-
to get in there like you are?
I would go ahead and get it clean, and then at the end, take a Q-tip and just dry it in there. You know, just kind of spin it in there to dry it. So you see it's a little irritated.
Yeah.
Blood is irritating.
Okay.
Yeah.
We thought that was still a healing scab. That's just
Yeah, that's just dried
We've been trying
blood.
not to touch it.
So this silver nitrate will dry it up chemically, and sometimes that helps it shrink away a little faster. So we're just sort of cauterizing this chemically, and sometimes babies are screaming by now. You've got a tough kid.
Oh, God.
You got a tough kid. So you can see it's turning that cord a little bit kind of whitish grayish where I'm applying the silver nitrate, and we like kind of get the base of that all done. And then occasionally this part of the umbilical granuloma that's red, that's because there's blood vessels under there where I'm touching. And this sort of helps them sort of just dry up. Now what I'm gonna do is get the excess off with a Q-tip. First of all, it's extra special red. But you can kind of see it's almost got a smaller base. And I'm gonna go get some water and just clean it all up. This is our kid who wouldn't smile. He's only 3 months old. There it is. There it is. There it is. You want to talk,
Oh, my
huh?
God.
You want to talk, don't you?
Dad.
Yes, you do. You got so much to say. Say, Doc, I'm not so excited about that umbilical granuloma. Hey there, what you doing? That's post-cauterization. I'm using a sterile Q-tip, and you'll see on the belly button here we've got some dried blood. We're just going to go ahead and clean that up. Blood is just irritating to the tissue.
Okay.
You can kind of see that it's a little irritated in there. You can get in here with a Q-tip. You can get in here with soap and water.
Okay.
I'll get another dry one, and then after you've cleaned it up with a Q-tip, you can get a dry one and you can actually stick it in there. So you'll see how.
So I was worried his diaper kept catching and was making it bleed over and over again.
Gotcha, it would just catch it, yeah. So after you get this all clean, because that redness is just irritation, because blood is so irritating.
Okay.
You can clean it with soap and water on a Q-tip if you want, or just water.
Okay.
And then get a dry one and just stick it in there and spin it.
Okay.
Just to dry it. You can see it's a dead end.
Okay.
People are like, oh, what are you doing? I'm actually putting a little bit of pressure. It doesn't go any further.
Okay.
It might still have, because you know the the babies are attached to mommy through the umbilical cord that comes right through that belly button. Well, there's blood vessels in that umbilical cord, and sometimes those blood vessels aren't quite coagulated off, which is why we're getting some red blood. Here we are at 2 weeks and we're still getting a little bit of red blood. So you can actually hold a little pressure like I am here for a couple minutes, and that sometimes will just stop it from continuing to ooze red blood. Interrupting a feeding is never a good idea. We wanted to show you an umbilical hernia because parents worry about that. I mean, there's that big bulge. This one is about almost a centimeter diameter, fingertip wide, and when kids scream, the abdominal pressure goes up and it bulges even more. So, you're always wondering, do I need to have surgery, for example? The answer is almost never. Like 99% of these heal up and close up on their own. Now, if it's a 2-inch, huge, you know, ping pong ball or larger size defect, yeah, you're probably gonna need surgery. I predict that this will close by age 3 to 5, possibly sooner. And the only thing, which I've never actually seen, so I don't know why I'm saying this, I've never seen this, but if a loop of bowel was to get out of that little opening and then get stuck, it won't. But if it were to get stuck, you'd have a loop of bowel obstructed, and so now you've got a bowel obstruction, and kids will start vomiting, and it would not be good. And we're just gonna get this scab off. There we go. So there's that scab. Off. Perfect. And you're good. So what you can see there is, I guessed wrong, there's a little bit of white there in the middle, but also some pinkish tissue. It's still a granuloma. And we're gonna cauterize that so it just sort of dries up. We're a wiggle worm here. So I'm gonna use a little silver nitrate stick. And we're just going to zap this. You got it? Got it. We're just gonna zap this with silver nitrate. You'll see it turn sort of whitish. And this is a chemical, what we say, chemical cautery, which is a fancy term for a chemical burn. You didn't hear that, Mom? Oh, I'm so glad you had the look, you know, you're better at the pacifier than I am. What a shock. Babies love their mamas. I don't know what it is about that, but your hand, your voice. So we're done. Happy baby, that's now whitish. It's drier. You can see that. That's not going to give you any more trouble. Alright, so that's a little kind of bleeding, isn't it? Does it ever get foul odor? No? Okay. But sometimes if the belly button is infected, it'll kind of have a foul odor. There you go. There you go. There you go. It's okay. So, I'm just going to take a look at what we got going on here.
Okay. You're okay.
So, that little nubbin of tissue just been bleeding right there. That is like a little, so usually what we have going on there is an umbilical granuloma. It's just a little leftover growth. Yeah, kind of a little growth of the cord that's just left over. And generally we'll cauterize that, and I'm gonna do that. I'm gonna grab some silver nitrate, if that's all right with you. And we'll just zap that, and that should hopefully keep it from bleeding and help it shrink. Silver nitrate stuff. All right. This can hurt just a little bit, so if we get a yelp, it's real. And we're just gonna zap that.
It's okay.
That little.
Good boy.
Obviously, for the viewers, you can't really see what I'm doing, but there you can kind of see now. There's that little umbilical granuloma right there. That was red, and it was kind of a little, maybe hemangioma, a little blood vessel growth.
It's okay.
Now we can see better what we were dealing with under there.
Oh, wow.
I'm going to dry off the excess. So silver nitrate gives you this black, and it's a little irritating to the skin. So you want to get the excess off. All right, so we're gonna take a look at this cord. The cord was that fat, right? And it's drying up, and this white tissue is called a granuloma. And it will eventually get absorbed. But we can help it along with just a little drying agent with some silver nitrate. And so we're just gonna touch it to the granuloma itself, and this will help dry it up. I'm sorry. And then usually you can just take this apart with this. There you go. There's your souvenir. We can throw that away if you don't want it.
No, I'll take it.
Yeah, it's actually, I threw one away one time, and the parent was so upset. She said, "That's genetic material." That's true.
Okay.
You know, well, within that cord is genetic material. There are people who save cord blood, right, to have that genetic material. So that's dried out. I'm just going to clean up the excess. So, you know, within a few months, this will all look totally normal. Some babies who have a really thick cord will momentarily have an outie, but it doesn't mean it's going to stay in.
So no washing though until it.
You can have baths now. There you go. So it's about a centimeter or a little bit less than a centimeter. This is actually what's called an umbilical granuloma, and that little red nubbin of tissue is just sort of extra growth.
Yeah.
And it can be confused with a retained cord too. So we just sort of roll the silver nitrate over it,
Am I tickling you?
and
Am I tickling you?
we're sort of chemically drying it up. You can almost see it getting pale compared to how beefy red it was to begin with. Good job, Mom, distracting. That's excellent.
Did that tickle you?
Usually they're screaming by now.
Did that tickle?
Okay, viewers, you're gonna have to give this mom a huge thumbs up because this is the most effective support I've had in a really long time of doing something that's actually slightly painful. Now what I like to do after I've zapped it like that is just get a dry, clean, sterile Q-tip and get all the excess silver nitrate off of there, because this stuff will burn the skin if we leave it on. So we're gonna get as much of it off as possible, like that. So we're just gonna move this around. We're kind of goopy under there. I like to get that cleaned up. So this is a clean Q-tip with just some water, good old-fashioned water. Oh, I know you don't like that, but you can see how we got that pretty clean now. And I'll get a dry Q-tip and just dry it up. So there's a little bit of cord tissue that's still stuck on there. When this falls off, there'll be a little bit of retained cord, no big deal. Parents don't need to worry about that. It's actually good to get air in there. And sometimes when you move it around, it'll bleed a little bit. You can see a little bit of redness there on that cord. We'll sometimes cauterize that, zap it with a little silver nitrate. That would actually dry it up so it doesn't stay goopy. I think I'll grab a quick little silver nitrate and touch that up. Be right back. Okay, so a little silver nitrate just to dry that up. And that turns goopy cord into dry cord. And you are brave. Most kids are screaming by now. Got a tough one here. Move it around the other side. Okay.
Did really well.
Yeah, get the excess silver nitrate off of there. And you're done. The umbilical cord came off, and get closer, 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 closer. Keep getting closer, closer. And then you have come in and had that cauterized how many times?
Twice now.
3 times? Okay. About a week or two apart? So this is a little silver nitrate stick, which we're just going to touch on it. And I'm sorry, buddy. I know. You can see it sort of dries that up. That bright red color is starting to go away. Silver nitrate is what's called chemical cautery. I know, buddy. You're doing so good. We're going to call it quits here. we're gonna call it quits. Good job. I think we'll say that's enough for today. So we'll get the excess silver nitrate off. Are you all better now? Huh? No, so you don't have any food for me. Put my finger on that and kind of wiggle it around, and it's smaller than my fingertip. So what we're looking at, if we were to look at her tummy, let's see here. I bet when she cries, that bulges up,
Yes.
right?
Yeah.
It's possible that a loop of intestine can actually push through that opening, and then when you go like this, you feel that little squishy. Yep. That's the intestines going back into that little defect.